Saturday night was tragic for Kanye West and his family. As we reported, West's mother, Donda West, died due to complications from plastic surgery. And according to a preliminary coroner's report, there could have been a couple of things that may have happened. So what did go wrong? Here to discuss the potential dangers of plastic surgery is Dr. Stephen Davis of Davis Cosmetic Surgery in Cherry Hill, New Jersey. Good morning.
Good morning.
Well, let's talk first of all about the surgery she had. She apparently had a tummy tuck and a breast reduction.
Correct. She had both of those done at the same time. Each one by themselves is a pretty big operation. When you combine them together, they're a huge operation.
Yeah, that's a lot for your body to have to deal with. Okay. Preliminary, now TMZ.com saying that early reports say she may have died from a heart attack, pulmonary embolism, or massive vomiting. What happens there that could cause any of those?
Well, I think the best way to look at this really is to understand that over the course of hours your body is going through unbelievable changes. You know, if you're trying to lose 2 or 3 pounds, it may take weeks. Think about losing pounds within the matter of like 2 or 3 hours, 4 hours. She evidently had a lot of surgery, and from my understanding, she also went home. So instead of actually staying in a hospital or in some sort of post-op care facility, she went home. And occasionally that may be a problem as well. And again, all of these things have to do with what their medical conditions like prior to even coming to the operating room.
Yeah, and Dr. Davis, that's really big because for his defense, Dr. Adams, who conducted the surgery, his name is Jan Adams, and he says that he consulted with Donda West for 4 months, that over that time she kind of waffled about whether she wanted to do the surgeries or not. She was a little bit apprehensive about it. What are some of the questions patients should be asking the doctor?
Well, I always like to look at it like the patient and the doctor are like on the same team. So the doctor, the plastic surgeon, hopefully is trying to explain to them that we want to get the best result, not only for the surgical procedure, but post-operatively and for the longevity of the procedure. We want you to have the best overall result. How can we work together to make that happen? Well, one of the best ways is if you're really markedly overweight, the doctor and the patient to say, okay, let's put together a plan so that maybe you come back in a few months after you've lost a little. Or if you're a cigarette smoker, let's try to stop smoking before we even engage in doing the surgery. But a lot of other things like heart disease, lung disease, or any of the other things that could have been part of her past medical history, that needs to be followed up with an internist or one of her doctors to make sure that she's medically cleared to have that kind of a big operation.
Because there are people who they just say you can't deal with that much surgery.
Absolutely.
Now, the other thing is apparently this Dr. Adams had several malpractice lawsuits against him. So that makes you wonder, gee, how do you do your homework and find out if the doctor is right?
Well, this kind of thing can happen to any surgeon, any kind of surgery, anywhere. But for the patients to know, and I think for the viewers to really understand what this is all about, and maybe if anything good could come from something terrible like this, it really is incumbent upon the patients to really investigate the surgeon and also investigate key questions such as, does the doctor have privileges to do that cosmetic surgery in a hospital setting? Because many times that's our way of doing a checks and balance type of thing. We'll ask a patient all these questions in the office. Do you have high blood pressure? You're allergic to anything, etc., etc. But in the hospital, they're going to get that same kind of questioning all over again by not only the nurses, but the anesthesia department and everything else. So we're trying to spot, God forbid, any problems.
All right. Get to know your doctor and really know what you want to have done. Maybe do it in small doses. Dr. Stephen Davis, thanks for being with us. We appreciate it.
Thank you.
He's of Davis Cosmetic Plastic Surgery in Cherry Hill, New Jersey.